Without objection, then we will skip to item 8 on our agenda, our Green Themes presentation on climate change and health impacts by Lorraine Cameron, a senior environmental epidemiologist, the Michigan Climate and Health Adaptation Program, the Division of Environmental Health, Michigan Department of Health and Human Services. Thank goodness that was all written down here. No, that's fantastic. We're so pleased to have you. Thank you for coming along this evening, and we're looking forward to hearing from you.
Okay. Is Mike about it right?
Yeah.
Okay.
Sounds good.
All right. So thanks for the invitation. I actually live down in Cornell Woods, not that far away, so I'm happy to come and find out what's going on in my own community and talk to you about what I've been doing at the state of Michigan. And wanted to also acknowledge Aaron Ferguson, who I think originally reached out to. Aaron's our program manager, and he's been working with the Michigan Municipal League and their Green Communities program for a number of years. He's actually at another conference this evening in Grand Rapids having to do with Parks and Recreation and their intersection with public health. So I'm glad to be here. Thank you for your invite. And I'll proceed. How tight do you want me to stick to the timetable?
I think if you were to go 20 or 25 minutes, that would be
okay.
Excellent.
And we can be informal if people have any questions anytime. Just yell. I'll try to look over here, but I'm also looking over here, so let me know. And Jonathan, who's one of our staff epidemiologists, you can kind of give me the high sign. Okay? All right, thanks. All right, so so I always like to put my objectives of why I'm speaking out, because this helps me organize my thoughts. And really what I want to try to do in the next 20 minutes or so is, first of all, describe our Michigan Climate and Health Adaptation Program and some of the information that we've compiled over the last 7 years. We've been funded about what we've learned about climate in Michigan, what are the important human health issues, who's at risk and where are they, and how interventions can be used to help communities adapt. And secondly, talk a little bit about how public health can be integrated into local climate or adaptation planning, and where you can get more information. So just a little bit of background about our program. So I'm with the state of Michigan in what used to be called the Health Department. We are now part of the Michigan Department of Health and Human Services, as you said. And since 2009, we've had funding from the Centers for Disease Control and Prevention, along with 16 other states and 2 cities, under a program called the Climate Ready States and Cities Initiative. And this is a group that has been working on the adaptation end. So talking less about mitigation, and I'll get into what those terms mean if you guys aren't familiar with, but less about reducing greenhouse gases and more with dealing with the effects that we are seeing now from a changing climate. So I'm happy to hear that Jeff Andreessen is coming to speak with you. He worked with us quite a bit on our program, and I'm going to be presenting some data that his program gave us. This acronym here, GLESA, is the Great Lakes Integrated Science and Assessment Center. It's, believe it or not, jointly run by the University of Michigan and Michigan State University climatology programs. And they've spent a lot of time looking specifically at Michigan and the Great Lakes climate, both past and projecting into the future. So I'm going to run through these quickly because you'll get a lot more details from Jeff a little later this spring. So this map shows you what we know historically about the Great Lakes and area of Michigan, and this is from national data, the National Climate Assessment. And what it shows you in a nutshell is that we've been warming up. Since 1960, the average annual temperature has gone up about 3 degrees Fahrenheit, which doesn't sound like a lot, but if you think about your own body, and if you were at 101 versus 98, you wouldn't be doing so hot. So the other thing that you'll notice is that the red on the map, which is the greatest rate of change, is further north. And this is really characteristic of climate, of what's happening with our climate, that the the further away from the equator, the more drastic the changes have been and will continue to be occurring. And as you see here, I've noted that Michigan has warmed faster than the national rate of warming historically since the 60s, and more in northern Michigan than southern. So the climatologists have used the information that they have about greenhouse gases and climate patterns, and they've projected for us into not the far future, but the next 50 years or so. And we see that we're projecting to be warming another 1.5 to 4.5 degrees over that time period, but it's not even across the state, and it's not even across the seasons. So what we're seeing is that in the winter, in particular, things are warming more rapidly, and we sort of noticed how winters have been less severe in general in the past, and that's going to continue in the future. But also, we've noticed that the north is seeing more extreme changes in these seasons. The other important thing to think about when you think about warming temperatures is extreme heat days, or heat waves as we call them. When it gets above 95 degrees or so, then's when we start getting concerned about human health and about people getting heat illness or heat stress. And historically, Michigan has had some heat waves, which have been threats to human health. Not a lot as compared to southern states, but there is a projection that these will be increasing, again, more in the southern part of the state. So climatologists, as I understand it, basically measure two things. They'll measure temperature and they'll measure precipitation, and those are the things that they can project. They don't feel as comfortable projecting things like wind patterns, tornadoes, and things like that. So the other part of climate change is looking at precipitation, and this map shows what's been happening historically again since the 50s, and you see in general we've been getting more rain, but it's very variable across the area. And again, it depends on the season. We're going to see more rain in the winter, maybe a little less in the summer. We might even see some droughts. So this, again, more severe winter changes in the north and the summer droughts in the south. But the real concerning thing in the projections is what's going to be happening with what we call extreme precipitation or heavy rain events, which we've defined here as more than 1 inch in a day. And as you know, Michigan's had some really bad ones in the past. I think it was 2 summers ago when they got 6 inches over 24 hours in the Detroit area and had those terrible floods. So we are projecting to have more of these extreme precipitation days. Again, following sort of a north-south gradient where you see that it's going to go up by as much as 30% in the Upper Peninsula, but we're expecting it to go up in the future, something we're dealing with now, actually. Am I going too fast for you guys? Are you okay? All right. And no questions so far? As I say, I'm not a climatologist, so I'm sure Jeff will give you much more in-depth description. So this is sort of my understanding of the important points when we think about health. So as part of our project, we worked with the climatologists in Michigan to look at these changes that are happening in Michigan, and then we tried to figure out what are the impacts on health. And we identified 5 areas where we think it's important health impacts for our state. And this chart here sort of summarizes what we're calling the key health outcomes. These are things that will affect a lot of people and that are substantial effects. So the first one I have listed here is respiratory diseases. And so with the increases in heat and temperature, we're expecting more what I'm calling here a biophysical parameter. That just means something that's changing due to the change in climate that's actually having an impact on health. So the warming is leading to more air pollution, which is leading to more stress on the respiratory system. We are projecting that we may see more respiratory problems in the future with the changes in climate, with the changes in precipitation, with more mold and pollen, also giving people more respiratory problems. As I mentioned, with heat, you have direct effects of heat illness. Again, we're projecting those to go up as we have warmer summers. Because of the changes in winter precipitation, for example, from snow to rain or freezing rain, we're thinking that there's going to be more storms that can lead to power outages, which are hazardous because people then will get generators. And if they don't install the generator properly, they can get carbon monoxide poisoning. Plus the other things that can happen during a storm that disrupt people's ability to be healthy and get to where they need to go, the disruptions to transportation, other things. With the increased with the increased precipitation, we're thinking that we may have to be looking at waterborne diseases, and finally looking at vector-borne diseases possibly going up with more mosquitoes and more ticks. And I'm going to break that down a little bit more for you, so I know that's kind of a quick summary. So first, talk about air pollution and climate change. So as the temperature warms, we can have what are called air stagnation. So and you'll see this a lot more in urban areas like in Detroit, where you'll get these smog effects where the hot air just parks and you don't have a lot of movement of air, and so whatever fumes are from traffic, industry, whatever, they stay put and they accumulate. With the warmth and temperature, we expect that to go up. We also expect in places where they're using coal, in particular for generating electricity, such as the old power plant in Lansing, which they're going to be changing out. In the summer when it's hot, there'll be more demand for electricity. You have more coal burnt. You have more pollution coming off of those those energy plants. We can have the formation of ozone, which you've heard about during the ozone action days, a lot of times from car exhaust. With the warmer temperatures, the chemical reaction can cause the formation of ozone, which irritates the lungs. And finally, something that people don't think about, but this is probably something that planners can really get their heads around, is with the warming temperatures, we have a longer growing season. That means we have a longer season for pollen, which means we have a longer allergy season. And especially ragweed seems to love warm temperatures and lots of carbon dioxide. And so there actually are some studies saying that ragweed is going to become more irritating with climate change. And finally, as I mentioned, if we have more rain and flooding, we're going to have more mold accumulating afterwards, and that's also something that the mold spores get in the air and they can be irritating. I don't know how much you've looked at the data that is available about air pollution in Michigan, but this map takes data from the EPA, the Michigan Department of Environmental Quality measures particulate and ozone air pollution, and for EPA, and they send that to EPA, and we've been able to map the averages by county for both ozone, which is on the left map, and PM 2.5, which is a very small particle that can get into the lungs, on the right-hand side. And as you can see, I don't know if I have a little pointer thing, but so I believe that's Ingham County. I don't know, you can't even see that. So if you look at where Ingham County is, which is sort of in the middle, we're okay as far as ozone compared to the rest of the state. Our average is only 2 days above the standard, whereas the Michigan average is 3.6. But we're not doing so hot with particulates. We're above the state average, which is 9.7. Our average is 11.4. So that's something to be aware of as we go forward, that this is going to be an issue with the warming temperatures and with more generation of air pollution. Some people are kind of surprised to see that little band of high ozone along Lake Michigan, and that's actually blows across the lake from Chicago and Milwaukee, so air pollution can travel quite a ways. I don't have any data that's specific to Michigan about pollen levels. We only have one pollen measuring station that's recognized in the state, and it's over in St. Clair Shore, so it doesn't do us a whole lot of good out here in mid-Michigan. But if you look at this picture that's from an EPA document, there are some researchers that have studied the change in the ragweed season from 1995 to 2013, and you can see as you go further north, the ragweed season has gotten bigger, has grown more. So the increase since the 90s for the latitude, which is around Michigan, is somewhere around 15 days. So that means you have 2 more weeks of misery if you have asthma or allergies, thanks to the warming climate since the 90s, and we expect that trend to continue. And as I also mentioned, with an increase in carbon dioxide, we expect some of the pollen to actually become more irritating. I talked about heat causing health effects. This is a graph from 2012, which you might remember was a particularly hot summer statewide, and we had a really big statewide heat event in the early part of July, which you can see there's a peak with purple and green bars, and this is people that are come to the emergency departments in Michigan complaining about dehydration or heat illness or sun poisoning, things like that. And the solid line shows the average daily temperature, and they track pretty closely. So this is something as we would expect, again, to be increasing in the future as the temperatures get hotter in the summer. We expect more people to be visiting emergency departments with heat-related complaints. And here's from the subsequent year, but it kind of gives you the idea of the distribution by region of these heat complaints. This was another period when the state was pretty much in a statewide heat event, and Region 1, which is mid-Michigan, you can see we had 524 people visiting emergency departments with heat-related illness. So it does have an impact on people's health, and it's something that we can plan for and respond to. In terms of storms, there's a number of outcomes, and this picture is from Grand Rapids a couple years ago. Remember when they had the big flood? You can see some of the issues we worry about: physical injuries, drowning, motor vehicle accidents, the mold and allergy issue, exposure to infectious agents in the water, food and waterborne illnesses. People are displaced from their homes. Emergency services are interrupted. So there's a lot of impacts from flooding events. Just to give you a picture of what Ingham County looks like, I couldn't get these statistics for the township, but there is a database that NOAA has of storm events, and you can see all the storms since 1996 that were severe enough to cause deaths, injuries, something they call significant property damage or disruption, or were kind of just weird. And if you look at the chart, you can see that the most common types of storms that have been significant in Ingham County were thunderstorms or high winds. There was almost half of the storms here. But winter storms were right behind them with 25%, and this includes ice storms, blizzards, and these are the sort of things that can cause a lot of problems with people's health. We've had a fair number of hailstorms, and then there's a variety of other things. The database only recorded 2 injuries and 2 deaths, however, and those were all related to tornadoes. But we have an average of 21 significant storms per year in the county, so that's not insignificant, and it's something that can be planned for in communities, to have emergency preparedness, to have shelters, and to have response plans when the power goes out during Christmas, because the ice brought the lines down. You probably remember that one. I sure do. This is an example from that storm of carbon monoxide poisoning visits to emergency department, and you can see we were able to determine that 400,000 people in the state lost power, and we had, and the arrow shows when the power, the date the power went out, which was December 22nd, and you can see that blue peak right afterwards. That's the 81 visits that were made to emergency departments related to carbon monoxide poisoning. And we think, as I mentioned, it's most likely people operating generators unsafely and getting the fumes from the generator in their house. So this is something, again, a community can prepare for. They can educate. I know some communities that have put in regulations, for example, just like smoke detectors, to have CO monitors in apartment buildings. They have fire departments go out and hand them out and educate people. There's ways to prepare for this, to reduce the impact on health. This graph kind of summarizes some of the effects of extreme weather, but I want to point out the statistic that is circled. It says 51% of waterborne disease outbreaks followed extreme precipitation events. This, I think, is going to be a big problem for us in Michigan going forward. As you know, extreme rain can cause flooding, that can cause sewer and septic to mobilize, and it can contaminate homes, surface waters, and well waters. And this is something that I think we'll be addressing statewide. So I looked, again, I couldn't find good statistics for Meridian Township, but I looked up for Ingham County what I could find out about some of the risks. And turns out, at least for the statewide data, the only reliable data I could find on well and septic was from 1990 Census of Housing. After that point, the federal government stopped collecting that data, but this is the data DEQ also uses to project. And at the time, if you can see on the slide here, about 51% of households use private well and septic rather than public water. Now, if you take that 51% and you multiply it by the current population of Ingham County, you can see that there's about 62,000 people in Ingham County that are roughly that are on well and septic. This could have changed a little bit with development. I don't know. You probably have better statistics locally than I was able to get for the state, but it's a lot of people. The county health department reported an average of 56, 57 septic failures they investigate per year, which we know is not everything. So that's a little bit concerning. You may be aware that the governor has a water strategy which talks about septic and water quality and whether the state needs to have a septic code. And it turns out that Michigan has the distinction of being the only state in the union that doesn't have a statewide septic code. So that's kind of not where we want to be, I think. And the final point on this slide, I just want to, you may be familiar, there was a paper that came out from some researchers at Michigan State University in 2015 where they sampled watersheds in the Lower Peninsula and found 100% of our watersheds had human fecal contamination. Now, I don't know about you, but that bothers me. And I think this is an area that there's going to be a lot of concern at the state level, but within the township, it's something that I know you're interested as well and might want to think about how your planning can address that. Finally, I want to talk a little bit about bugs. I'm not an entomologist, but we do have one at the State Health Department, and he collects information on human cases of Lyme disease, which is carried by the black-legged tick, and he also does surveys for ticks. You can see on this map there's dark red counties and there's sort of pink counties. The pink counties have the ticks. The red counties have the ticks that are infected, or people have gotten Lyme disease from being in that county. And you'll notice that Ingham County is a red county, so that means we have infected ticks here. And I know from what he's told me that he has found samples both in Lansing and in Bath Township of infected ticks. So, something for the township to think about, especially when they're thinking about parks and walkways, what needs to be done to protect citizens from being exposed to potentially infected ticks. And there are methods to do that. Just really quickly, I wanted to mention planners. I don't know if anyone here is formally trained as a planner, but they have their, okay, so you have your roots in public health from the sanitary movements of the early 20th century. So you're our brothers. We are interested in working with you, with planners, to bring the public health lens into the master planning. This slide refers to a training that our department did with a nonprofit called LEA, which is promotes regional planning. And so we've developed some materials for planners to learn about how to look at public health issues. And I think not just for things like I've talked about with climate, but more generally, other public health issues. And this is just sort of the process that Leah had developed. Educate, engage stakeholders, use data. You can look for people's sensitivity. We know people who are elderly or are already impaired in terms of their health can be more sensitive. They have less reserve to respond when there's a stress on them, like a heat event or a storm or a flood. Also, people who are low income have less resources. So in your township, you can figure out where those people are, and those are your vulnerable people. You can also look at what parts of your township have potential for exposure to hazards. Where are the floodplains? Where do storms typically occur? And that's something that I showed you on a statewide map. Where are your septic combined sewers? I don't know if they're all gone here. I think they are. I hope. They've been all separated. Where the private wells are, where your green spaces are that keep things cool, where the heavy traffic is, where you have exhaust. And this area, Meridian, has done a lot already. I know they've done some things to reduce exhaust with buses and things. So this is the other part of vulnerability. And just to show you really quickly, other communities have actually been able to take these factors and map and say, these are the neighborhoods that we need to concentrate on. You can see this is a map of Detroit looking at heat and flooding. The dark colors are the highly vulnerable areas. So those are the folks that they need to think about first in terms of preparing for these events or responding. Finally, I hope this looks familiar to a few of you, the Mid-Michigan HIA toolkit, which was developed by the Ingham County Health Department, Michigan State University, also Barry, Eaton, and Mid-Michigan Health Departments, and the Tri-County Regional Planning Commission. And I know that some folks here in the township worked on this. Janine Sino in Ingham County Health Department manages this project. This link has some really great mapping capabilities that you can use for your climate planning. Janine mentioned to me that Meridian Township does a lot already using the toolkit in terms of looking at new projects. They've done, I think, 21 last year that she mentioned to me, but you can also use it for your climate planning to look at your climate vulnerable areas. You can look at your floodplains, for example, using this tool. So it's a great tool. I wish we had it for the entire state. I think I will leave you there. We have lots of resources here listed with links. I'll leave these slides with you guys. Please feel free to contact myself or Jonathan or Aaron at the State Health Department. There are some other resources here from American Public Health Association, LEA, the National Climate and Health Assessment, and so forth. And I thank you for your time.
Questions from the question?
Yes, sir.
I'll try one.
Okay.
Trying to digest all of this.
I know it's a lot, I'm sorry.
One slide that I saw, you had the number of days of increase of ragweed.
Oh, yes.
And I wondered, was that starting from the same place? I mean, the UP showed...
This one?
Yes. The UP showed 27 days increase. Would they have been at a much lower level, I presume, than, let's say, down around Lansing, which is going to have 10 more days?
Probably, yeah. This study used pollen monitoring stations that were in operation for quite a while, since the 90s. So those dots are actually cities. They're not in Michigan. I think there's like in Wisconsin and Minnesota, and then there's...
Oh, okay.
But they're on the same latitude as Michigan. But yes, I think you're seeing is a rate of change. And kind of if you think about like the USDA planning zones, how they've been changing over time, if you're familiar with those, if you're a gardener. It's the same sort of thing. I mean, we're starting from a cooler place, but we're warming up fast. We're not as hot as Alabama, although in 100 years they say we may be like Arkansas. But yes, you're absolutely correct.
Okay.
Very perceptive too.
That's big numbers up there in the north.
Yeah. Well, as I mentioned, what's happening with the changing climate is that things are changing faster the further north you go. I mean, the polar ice caps melting, that's rapid. In Alaska, it's just devastating change. But they're starting from a cooler place, but they're warming up quickly. Yes, ma'am.
You talked about water quality.
Yes.
Do you have any data do you have any data on the increase in harmful algae blooms in inland lakes? I mean, I know that there's a lot on ocean.
Yes.
But how about inland lakes?
The people who would have any information would probably be, I believe the local health departments would go out and measure and report it to the Department of Environmental Quality. They don't sample, and so this is not my area, so I'm not 100% sure, but I believe they typically don't sample everywhere every year. So they kind of go on historically where there have been problems. But that would probably also be increasing both with the warming temperatures and more runoff, bringing more nutrients into inland, just like they did with Lake Erie.
Right.
And there's a lot of action around Lake Erie, but I guess because it's so big and it's a major drinking water source for Toledo and also Monroe. But it is a concern elsewhere. I don't know how much data there is.
Yeah, I was just curious because I've seen a lot of data for ocean
Yes.
and marine environments, but I can't think of any data for inland lakes.
It is measured. I don't know the mechanism. I don't know if somebody just complains and then they go out and measure. I think it sort of depends on the use of the lake too. If it's a big lake that gets a lot of use as a beach, for example, they might be monitored more closely. And, they do also do the beach monitoring for coliforms, which is the
Right.
human fecal. And there's sort of a protocol for that.
Did they see increases in
Coliform?
yeah, or even in an increase in beach closures?
I haven't looked at that, but I think it is. People think it's a problem. I know, not here, but up in Charlevoix, that they have some major concerns about contamination of Lake Charlevoix and the issue of septic there. And I've heard that similar problem around Lake Lansing, but I don't know specifically. I would expect if you have a lot of runoff into the lake, you would have more
Yeah.
problems. And some of that depends on the soil type, and we have pretty impervious soil. Some areas where it's sandy, it goes right down. It's not as big a problem. But again, that's more of a Department of Environmental Quality thing. That's their responsibility right now to do those measurements with the local health department. If I was guessing, I would say, yeah, it's a problem. I mean, just based on the fact that we're finding it in all the watersheds. And it's human. It's not coming from animal confinement. It's not coming from dog waste. They use some sort of a DNA identification as it was human fecal. So, I don't know, anyone here water chemist or a microbiologist? Nope.
I'll make that a homework problem in air pollution this semester.
Well, Joan Rose might know the answer to that question if you know.
I know, Joe.
If you can get a hold of her, ask her.
I wonder if you could talk a little about the role of the state government related to adaptation.
Okay.
Are there any statewide initiatives kind of planned to kind of deal with these issues?
Okay. Well, Governor Granholm had a climate action plan. When she left, as far as I know, that plan was shelved. There have been activities, not only within our health department, but other parts of state government, to try to grapple with the issue of climate. I know, for example, MDOT, Department of Transportation, has been looking at impacts on infrastructure around major roadways. I know that there are folks in ag that are looking at issues in forestry and so forth. I think it's been sort of done very quietly. I don't think there's no official state policy or official state climate action plan since the Granholm plan. So what we're doing, for example, is we are working as a grantee to the Centers for Disease Control and Prevention, and this falls kind of within our mandate to prevent or mitigate diseases in the state. So I don't know if that's answering your question, but I'd say that there's no policy per se that I'm aware of that encompasses all state government. I think each department or several departments within state government are thinking about, I know, for example, state police has been looking at a lot, for example, in terms of, critical infrastructure and emergency response and things like that. And as I mentioned, ag, I know Extension is doing a lot. They're quasi-governmental, I guess. They're really part of MSU. But there's nothing that you can point at, like at a state website, that is all-encompassing. I'm sorry, I can't be more specific.
No, that's...
But certainly if you have any questions about the health end, we'll do our best to respond. Can I answer any other questions? Yes, sir.
I'm sorry, go ahead.
You mentioned Lyme disease
Yes.
and Blacklegged ticks.
Yes.
What are the vectors for those? Are deer a possible vector for
Yes.
those?
Could you repeat the question?
Yeah. So the question was with regards to Lyme disease. And let me see, I brought an extra slide on that. And the black-legged tick, and yeah, there it is. And what the vector for the tick is. Well, It turns out that deer, these ticks do like deer, but they also like other mammals, so they like mice and other rodents, and they'll even attach to birds. So there's been some investigation about culling deer herds as a way to prevent Lyme disease, if that's what you're getting at. And from what I understand, talking to Eric, who's our medical entomologist, that's not very effective because there's so many deer. Like if you killed every deer in Meridian Township, they just come in from other places and it'd be like nothing happened. So the types of controls would affect some of these other things that he listed here. This is what he's done in some places in the state, like on the west side where it's a really big issue. They'll have public education in parks. They'll have signs up reminding people to check for ticks, how to, wear the coverings, tuck in your pant legs and such. Spray with insecticide, and then the cultural and landscape controls, which is also sort of more of a infrastructure type of thing, where you can actually, if you remove the foliage from around the trail so that the ticks can't hang on there, and when you brush up against it, it jumps on you. And these desiccation barriers, which you put in strips where it's dry, and they don't like that. So there are some mechanisms that people have developed, and mostly from states where it's really rampant, such as west of us in Wisconsin and Minnesota, or east of us in New England. I mean, we're sort of in the middle. It's coming. We're in the pincher. But they have hundreds and hundreds of cases a year, and so they've developed some of these methods. Does that answer your question?
Yes.
Okay. Was there another question?
Well, I'm making a list of things that seem like they're worth following up on from your presentation.
Okay.
And the easy thing to do is to ask the staff to report back to us on all these things, but there will be other ways of handling this. You posed a specific question about the Mid-Michigan Health Impacts Assessment Toolkit and
Yes.
the degree to which that's being regularly implemented in evaluating development projects in the township.
Yeah.
There was an issue of whether there is or could be any regulation of or promotion of CO2 monitors or CO monitors in order to avoid those accidental poisonings.
Yes.
There's then a set of questions around the issue of increased rainfall that have to do with potential vulnerability.
Mm-hmm.
And those come down to how many private well and septic systems are there in the township, and how are they regulated? From what you said, there is no statewide regulation of those, so
That's correct.
it raises the question of what, if any, local regulation is there or should there be?
Well, wait. Let me correct myself. There is no standard for septic. And in terms of installing, I believe there are regulation for both a well and a septic. And there may be local, like the county may have a regulation, like a point of sale inspection. So I want to be clear. It doesn't mean like they're just nothing.
It's not free for all.
It's
regulated at the county level, which
Okay.
actually means that there's 81 different sets of regulation.
81.
One for every county.
Yeah, and you also have to think about how much staff they have to enforce any inspections or regulations. If you have thousands and you have 2 sanitarians in Ingham County, and I don't know how many they have, but yes.
And the last one was the question of whether there are any combined sanitary storm sewers in the township, or what the potential is for cross-contamination in the case of flooding.
That has been an issue elsewhere.
Mm-hmm.
As I said, I don't know. I know Lansing has separated their sewers. And there's been a project going on since the 80s, I think. So probably they're separated here. It's just I do know some of the older cities like Detroit, they still have combined sewers. And they have big problems when it rains. So those are some of the things you could consider. There may be other things that make more sense for the township, which you would know better than I.
So it sounds like a mix of questions that might be posed either to building and engineering or to public works, to county authorities, if we wanted to learn more.
Right, and I mean, you can look at your history here in the township to identify which seem to be the big issues historically, because what I'm seeing when I look at the issues on climate change, it's like it's going to be more of whatever we're getting now, you know. If we get floods now, we're going to get more floods in the future. And if we have heat events now, we're going to get more heat events in the future. That's, I know, a simplification, but that might give you some guidance as to, you know, if there's been a history in the past of like a lot of power outages, for example.
Right. Well, certainly the township mounted quite a vigorous response to the big ice storm that you referenced, and it sounds as if, in general, folks were pretty pleased that the township took an active and rapid role in that, and it seems in this transition from a colder to a warmer climate that one might expect maybe some of those ice events to be happening that might in the past have been snow events. So that may be an issue for planning going forward, both in public works and emergency services for the township.
Yes, and that's my understanding.
Great. Other questions?
Okay. Well, thank you.
Well, thank you once again for coming tonight. We're very glad to have you and appreciate your taking the time.
Well, I appreciate the invitation, and do feel free. I'll leave you with my card. You can email or call if you want, if you need some follow-up.
And you have a copy of the PowerPoint with the staff?
What I'll do is I need to make it into a PDF, and then I can email it to you. I think it should go. I know it's really big as it is now because of the maps, so I couldn't email this, but or do you can just turn it into a PDF if you want.
Yeah, we can work on that outside out. I'll come to you probably tomorrow. We'll post it.
That's fine. Yeah, this is your tax dollars at work. Well, thank you so much.
Thank you.